I suppose I'm talking about something in particular very obviously when I talk about that. And mainly I'm talking about Roscommon County Hospital, about the situation there where there is, I suppose, a situation that has developed over the past number of months where the HSE, which has been totally revamped and changed over and is now a new organisation which has very little input from political representatives, and that organisation has been given a certain budget by government. And government policy at present is to centralise hospital services. That means moving them away from smaller hospitals and putting them into larger hospitals. And Roscommon Hospital is suffering from that. The first, if you like, blow to it is that they want to take away surgical services from Roscommon Hospital and put them into Portiuncula. Now, that's something that has happened in several hospitals around the country. Monaghan is the most glaring example and has got the most, I suppose, high profile of it. And people have been brought to Cavan and find we have huge problems there with overcrowding because there wasn't any real energy or effort made to improve the facilities at Cavan Hospital when they ran it down in Monaghan. And we're very much conscious that the same thing can happen, and I have no doubt will happen, in Roscommon. And it is an excellent hospital that has served the people of County Roscommon very well for a very long time. And I think it is scandalous to think that this would be happening. Now, certain, I suppose, government TDs have suggested that they are going to save Roscommon Hospital and they're going to do this, that and the other. But the reality is that it's government policy, and they cannot, with the best intention in the world, they cannot change the policy for one particular hospital. They have to change the entire policy for the whole government. And I think that will not happen until the government changes. And really it is the policy of the Progressive Democrats and Fianna Fáil for to drive forward this agenda of privatisation, which it is all about. First of all, they will run down the local hospital. They move it all into a central hospital. They want to build 9, if you like, super sites where they have both private and public on the one site. They're giving away land for free to the private sector to build these hospitals. And the little local hospital back in Roscommon or wherever else will become little more than just a convalescent home. And most of the work will be done in the private hospital because there's an agenda there for to try and create a profit situation where medicine is a business rather than a service. And certainly that's something that I would be totally opposed to. And I expect that after the next election, when I'm a TD, along with many other Sinn Féin TDs that we'll have across the country, that whoever is in power will need our support. And certainly our support will be dependent on a change in that policy for all of the country, not just for Roscommon, but Roscommon will be one hospital that will benefit greatly.